Live with Kerry.
How's everyone doing today? It's been a while since we've actually come to you live, but with a lot of things going on, we got some updates.
And we're keeping social distancing, 6 feet apart. Where's your mask? Where's my mask?
Yeah, where's your mask? Yeah.
So we're not out in the public, but every time that we are out in the public, we suggest that you guys do have a facial covering because you need to protect yourselves.
Right.
We've been really busy. Kerry has been really busy lately, and we've been really busy helping the public and helping senior citizens and older adults here in Arizona. So we're glad that we've had the opportunity now to come and give you guys some information and kind of pull everything together that's going on.
Right. Yeah. One of the things we're hearing are people asking us, where do we find the best information? And so right now, we would say two of the places that we look is CDC and also Arizona Department of Health Services. And every day they do a live update. And if you don't see it live on Facebook, then you can always go to the website and replay it. That's probably where you're getting the most accurate information, especially for Maricopa County and for our state.
So right now we have 4,234 cases in Arizona, out of which there are 150 unfortunate deaths. That is the most current information from AZDHS for Arizona.
Right. And one thing someone's asking about the COVID hotline. So 1-844-542-8201. And that's the COVID-19 hotline. And so you can go to that and get more information also.
And they do put you on hold for a little while, but just keep calling and keep trying. There are a lot of calls coming through. If you need help with policies and procedures, the Arizona Assisted Living Homes Association, ALHA,
right,
has put some forms together that was put out publicly and is helping a lot of the homes have some policies and procedures that we all need to have in our homes regarding COVID-19.
Exactly.
So you can email us at INtouchSeniorServices@gmail.com. We'll repeat that email in a little while, but you can email us and then we can get you in touch with one of the ALHA board members to help you with your policies and procedures in the best way that we can.
Right. Also, I won't say we weren't notified, but at this time, AZDH is not doing any annual inspections. They are doing...
What are they doing? So they're doing the initial inspections.
Initial inspections.
So at the moment, they are not doing the annual inspections. You are right. But that does not mean do not stay compliant. Continue to be compliant, because if there's a complaint, they will come out.
They are coming out on the complaints.
So if you're not doing the right thing and someone complains, they will come out. So make sure that you guys continue to follow the guidelines and do everything that we normally would do to keep all of our senior citizens and older adults safe.
Right. One of the things we want to also say that ALHA, your representative, your association, we recently tried to get PPE for our homes, but we were rejected by the state because...
do we have a reason?
Well, we really don't have a reason, but we know where we can speculate where we fall on the totem pole. And they wanted to get them for the hospitals, and I understand that, but it's still, I think our homes, we need the information. We need the PPE in their homes as well.
So at the moment, the state did refuse PPE for assisted living homes in Arizona. That was requested by ALHA, but ALHA did send out an email with some other links where you can try and find your own PPE. So we'll be sending out a newsletter to everyone in our system and in our database, to all the homes and providers, with all these links where you guys can log on and what stores and what other places or other people might have PPE to where you can purchase for your homes. Also, if you feel like you might be having the symptoms or you want to be tested, contact your healthcare provider and they can help guide you on where to get tested, or if you want to find out more information about where the testing is.
Right. So some other things that are happening in our industry, pastors.
What is pastors again?
Well,
for those that don't know.
Well, pastors is a placement association.
Absolutely.
And so one thing that they're doing, you've probably seen it posted several times, they're asking for homes that are actually taking these patients.
And they were on the news recently.
Well, yes, they were.
5 or 3?
Both. Yes.
Yeah, so pastors went on the news in effort to bring some awareness to AZDHS, because AZDHS has not been able to give them a list of homes that are accepting COVID-19 residents. Now, if you have an active home and you have residents and you're refusing to take COVID-19, that's understandable. You're keeping yourself and your residents safe, and that's okay. But if there are homes that are initial homes, you're just now starting and you don't have any residents, it's okay to have COVID-19 residents if that's something that you want to do. And if that is, can you please contact us? We do have a list. It's small, but we have a list of some homes that don't have residents and are taking COVID-19. We need your help. These senior citizens and older adults are staying in the hospital for a long time until they can find a place to go.
Longer than they need to.
Yes. So please understand that side as well. If you don't want to take them, that's okay. But if you do, please let us know.
Right.
And then we can let passers know so that a lot of the policeman agents that are contacted, can help. And keep in mind, if one of your residents gets sick and they have to go to the hospital, you're going to want someone on your side to help you with the safe discharge if you decide to take them back.
Another thing, I know a hospital recently contacted PK with Elder Sense as far as using her site, because at this time her site's updated and accurate, and they list all the homes, and so she's posted out to a lot of the social networking to update her list. If you're able to take the COVID-19 patients, please go in. You have a free listing and a paid listing, but right now there's a spot that you can say that you take the patients in the hospitals. They can go on.
Is that on eldersense.com? They can post it and say we're accepting
Yes.
COVID-19?
Right, so they can go to Elder Sense, and that's good to the hospitals. They're looking for one location. And actually, I think that the Arizona Department of Health Services is reaching out and looking at her site, because they, all the skilled nursing facilities and the larger facilities, there's a place for them to go in and document it, but there's nothing for the smaller homes. And so there's an opportunity for you to get in front of the hospital case managers because of that. At this point, they're looking for places to put patients, especially, they say that the curve, the curve hasn't been flattened, and I guess our peak time is in the next 2 or 3 weeks. So we're trying to help them make places available.
Absolutely, and I appreciate everyone that's continuing to work together. Someone else that we're going to bring up is Voss Barrows with Senior Healthcare Solutions. Thank you for everything that you're doing. If you guys want more information, go and follow his page. He's currently, and constantly posting about everything going on and trying to do the best that he can to provide more information. And he tried doing housing, and so far that hasn't been accomplished, but he's still trying.
He's still trying.
And then every Wednesday, is it Wednesday?
Every Wednesday at 1:30, he's doing a networking opportunity, Facebook Live. And I guess they're allowing 10 people to come in and speak every Wednesday. So again, reach out to him and his page. Also, Michael Baker, he's part of the board, ALHA board, and he has his page. And for this
Assisted Living Homes of Arizona. But you have to be an owner or a manager to join that page. So if you are an assisted living home owner or manager, please join that page for updated information and a lot more resources that are really hard to find since we have the stay-at-home orders. So that is a lot of information.
Another thing, HSAG, I don't know if many of you are familiar with HSAG, Health Services Advisory Group. And every Monday and Thursday, they've been doing updates with the hospitals and things. And so actually it's going to start just on Mondays at 4 o'clock. And you can go to hsag.com and get information, hsag.org, and get information about how to attend the webinars online.
And again, this is a lot of information. We will be sending all of these links and information out to all the emails in our system. The other questions are, what are we doing with hospice and home health in your homes?
And one of the things, we always want to look at best practices. I know right now Medicare's changed a lot of the regulations right now to make it easier for hospice and home health to come in and provide the care in your homes. Actually, not come in. We're able to use telehealth or your telephone. A lot of the, the HIPAA that we've always talked about, they've kind of thrown that out the window at this time.
So VA's doing that too, actually. I got a call from them today, scheduling an appointment next week on a video call. So thank you for all those providers that are doing telehealth. But what are some of the best practices that your medical providers can do when coming into your home if they absolutely need to?
Well, the first thing, they need to call before they arrive, because again, at this time, You're just not letting everybody in the door. So if they call before they arrive. One of the main things that I've talked to a lot of the home health and hospice is all their clinicians before they go to work every morning, and I think in the middle of the day, that they're checking their temperature, and then they're having to call the company that they work with to say what it is. Also, when they come to the door, they should, some of the homes are actually making them check their temperature in front of them.
And hopefully you all have a thermometer. Because technically we should have all had a thermometer in our first aid kit. But hopefully every care home has a thermometer. If you do not, email us. Maybe, just maybe, we'll get some more.
Right. And then also,
make sure they have a mask.
Right, a mask. No
or
mask.
Facial covering.
Yeah. No facial covering. You can't come in. And also, we've kind of heard, which is kind of sad, but we want to make sure when they come in with their mask, they can't take their mask off in the home.
After entering.
After entering in the home, they need to have the mask coming in and leaving, going out of the door.
Absolutely, and that's really important. And one of the things that's really important, if any of you healthcare providers are watching, any of the homes, you want to know what the best practices are, is make sure that your healthcare providers does not interact with any other of your residents and any other of your staff unless it's absolutely necessary. They should go into the resident's private room, meet with them there, and then exit as soon as possible, and not stay inside the home or meet in a general area to do any charting, but
right.
to exit the home as soon as possible. We really want to keep our senior citizens and our older adults safe through all of this.
Right, exactly.
So if you guys have any questions, again, you can email Kerry and I at INtouchSeniorServices@gmail.com. If you have any questions regarding any of this, we will take all of your answers, and then we're going to go through your questions and answers on the next video coming up. Also, we've gotten a lot of donations from a lot of you helping out a lot of low-income families and senior citizens throughout Arizona. It is greatly appreciated as you continue to do so. We appreciate it. But if there's some that need donations, please let us know, and then we can try to get some and provide them to you as well. Anyone in need, please let us know, and we will try to find someone that has it or find a way to get it.
To get it to you. So.
Absolutely. Thank you so much, you guys. We will see you soon. Kerry, do you have a final wrap-up?
No, I just want to say, everyone, let's be safe. We know it's a crazy world in which we're in right now, and it's unprecedented, but we need to do all the things that we're hearing to stay safe, to take care of residents.